Good evening, everyone. And we will now begin the media availability with our update and turn it over now to Dr. Janice Fizgerald.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media briefing yesterday, we have no new positive cases. It has been brought to our attention by our province's public health and microbiology lab that a case previously reported as positive on April 18th was in fact negative. Therefore, the total number of cases in our province is actually 256. This was not a false positive test. It was just a clerical error and entered improperly. By region, we have 238 cases in Eastern Health Region, 8 in Central Health Region, 4 in Western Health Region, and 6 in Labrador-Grenville Health Region. 52% of cases are female and 48% male. And by age, we have 22 people under the age of 20, 37 between 20 and 39, 37 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 6 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 199 people have now recovered, and in total we have tested 6,662 people. Our unrelenting actions over the last number of weeks have made a direct impact on where we are today. You have made a significant contribution by strictly adhering to the public health measures in place, and our dedicated, highly skilled public health teams have done exceptional work in contact tracing and testing. The success we have achieved to date belongs to each of us, and I offer my heartfelt gratitude and appreciation to you all. We are aware of the ongoing outbreak of COVID-19 in Curl Lake, Alberta, and there are many workers from Newfoundland and Labrador based at this oil sands camp. Today, I'm issuing an order that will require workers who have returned to our province from Curl Lake since March 29th, 2020, to isolate for 14 days. Workers are advised to contact 811 for appropriate follow-up. You will then be referred to public health for testing, whether you are symptomatic or not. If you test negative, please continue to self-isolate for the remainder of the 14 days. Close and household contacts should also self-isolate while you await your test results. If you test positive, please continue to self-isolate. Public health officials will follow up with you to provide further guidance and advice. For further information about this new order, please visit gov.nl.ca/COVID-19. I know that we are all eager to return to our lives, our daily routines, and the family, friends, and co-workers we dearly miss, but we are not there yet. There will come a time, though, in the near future when we will be able to relax some measures. This does not mean things will go back to normal as we know it, as this is not likely to happen for quite some time, and normal may look a little different than it did before the pandemic. For now, we will have to learn to live in a new way. What this looks like exactly is still unknown, but what we do know is that we have made great strides in slowing COVID-19 in our communities, and we will remain in this together, supporting one another until a vaccine is available. When the time comes to loosen some public health measures, it will take place slowly and deliberately and with careful evaluation. If we do this properly, it may prevent us from having to re-implement stricter measures, although that may still be required while we continue to move through the pandemic. As we do begin relaxing some of these orders, new ones may be required. For example, measures to ensure businesses are permitted to reopen can do so safely, and those to enhance travel regulations that allow us to continue to track and control possible cases of COVID-19 entering our province. If such measures are implemented in the future, it will be with the health and well-being of the public top of mind. Our public health officials are actively investigating how best to relax some of our public health measures, and determining how and when to loosen these measures is much more difficult and more important than putting them in place in many ways. We are trying to achieve a balance between protecting the public and giving back some of the freedom that we have all temporarily lost due to COVID-19. We want to get this right. As we work through the process, I ask for your continued patience and trust. Your health and well-being and that of your loved ones is at the forefront of every public health decision that we make. Please continue to work with us so that we can make this work for you. Despite the hardship we have faced, we continue to rise to the challenge. This is what we do. In years to come, we will look back on COVID-19 as the difficult time it was, but we will do so proudly remembering when the chips were down, Newfoundlanders and Labradorians came together once again in solidarity to support our own. I would like to thank you again for tuning in and listening each day. Thank you for continuing to do your part. We are in this together, and we will get through this together. Thank you.
Well, thank you, Dr. Fizgerald. Not too often in our life will we look at getting a 0 as being good news, but today having a 0 is good news. But like Dr. Fizgerald said, we just can't let those numbers fool us yet, as we know we are still in the middle of a battle. People around the world, if you listen to media reports and people that report on this stuff, and they talk about it at length, they talk about this as a war. And the difference here is that we're fighting a virus, and we know that battles are won with commitment. Battles are won with determination, and we can win this with your shared commitment. It's by working together, as Dr. Fizgerald has just said. It's family with families, it's communities with communities, provinces with provinces, and indeed working with our federal government. That is how we will win this battle. We will win it together. I have said in the past, the system that we rely on for our health care, and hopefully it will not be because of COVID-19, that system will fail only if we fail. So as we know, there is a lot at stake, and we must continue to push forward. Dr. Fizgerald's guidelines that she's put in place based on evidence and science, we know now are working. We really appreciate and thank her for the great work that she and her team are doing. But we can't put our life in danger by relaxing too much or taking not accepting the responsibility of continuing on with those guidelines. And we trust that you and our communities, that you will do the same. There's lots of talk in recent days about reopening our province, reopening our businesses. We addressed this a little bit yesterday. We all want to get back to whatever the new normal is in our life, but it will be a new normal. As I said, we want our businesses to open. We want to get people back to work. We want our kids to be able to play with one another. We want to be able to visit our seniors or have social connections with them in their long-term care homes. We can only do this when it's safe to do that. So we still require some patience. We still require your commitment. Because what we're talking about here is your health. It is our top priority, and I know it is your top priority as well. So let's continue to work together. Let's continue to abide by the guidelines, follow the guidelines that are put in place, and we will get through this. As Dr. Fizgerald just said, we really want to say thank you in a very genuine way for your efforts and your commitments so far. We still have some ways to go as we plan to reopen the future of Newfoundland and Labrador. So we will continue to work to protect each other. There are some actions that we can actually be able to take to support each other. One example of supporting people in our community is something that's is a day like today. Today is recognized as National Takeout Day, and like many industries and restaurants, they play a vital role. So I want to say thank you to all of those that have managed to stay open, because what you're doing is you continue to supply meals to our first responders, those essential workers in our society, and everyone that is in self-isolation. So I appreciate how difficult it is to run a restaurant in some difficult times or in normal times, but it's much more difficult in the challenges that are added to your operations today. But I know we can help you today if you're in a position, if you are able to support our local restaurants by ordering out today. And speaking of putting new programs in place, and now we continue to support each other, as I said so many times, we are working very closely with our federal government. And just a few moments ago, the Prime Minister Trudeau announced some supports that we've been waiting for some time now around post-secondary students and graduates, those that are impacted by COVID-19. There's a $9 billion plan that's been put in place to have some financial support for our students over the summer. This will help students as they continue to plan for their summers for this fall semester, and those that we're looking forward to gain experience to start their careers. One program is the new Canada Emergency Student Benefit, and that was announced for students who do not qualify for CERB, which is a Canada Emergency Response Benefit. And if you remember, that was a plan that was announced in April of this year. So that's the new Canada Emergency Student Benefit Plan that was announced today, as well as the new Canada Student Service Grant. This grant is to help support students gain work experience and skills if they help in their communities at this time. Also, there's a program for students who are lending their time to a national or community service, and that will be up to $5,000 for education in this fall. So there's quite a few programs. We have the information that's available on our COVID-19 website. There's programs there that will mean and will create some 116,000 jobs in placements and training for students over the summer, and plus doubling of the student grants for those who are eligible for full-time and some for part-time students. Indigenous students, there's information for programs that are available to you, and also for those graduate students that would have expiring scholarships. So there's quite a bit of information. Details are on our COVID website, so we'd encourage you to go and visit and take a look at that information. Now, over the last few weeks, we've announced a lot of supports, both provincially and federally here, as we meet with you every day. We've answered a lot of questions about COVID-19, about the virus and the impact on our communities, about PPE, which is the personal protective equipment that's becoming a household name as we speak to you every day. But we also talk a lot about the health guidelines that's been put in place through our public health and the impact that they are having on you. But there's one thing that I know that I cannot, and people at this table really cannot speak to, and that's about the experience. The experience of having someone who would have received a call saying that you were positive, you tested positive for COVID-19. And also to speak to someone or to get some insights of what it was like to go through this and to someone who would have recovered from COVID-19. Well, tomorrow we're going to bring someone in who has that experience, and that's an individual by the name of Bill Woolridge. And he's a gentleman who contracted the virus at the funeral home that we so often talk about. And what he's going to do is he's agreed to share his story with you. It's an interesting one. And we're thankful for having Bill available to us, for sharing his insights, as I said, on what it is to get the call and to be tested positive for COVID-19. So as I conclude my remarks today, let's continue to follow the health guidelines. The measures that are put in place will make the future of Newfoundland and Labrador even a little better. Maybe not as normal as we're used to, maybe not as normal as we would like to, but the new reality is we will get back to be able to do some of the things that we would enjoy doing. But as the Dr. Fizgerald said, we are a resilient bunch, and we've responded, so far. And I really want to say thank you for the great work that you are doing. This is where that our province has shone in the past and will continue to shine into the future. And I can tell you, as your Premier, I'm very proud of the work that you're doing in our communities. So let's continue to work together. And I now turn it over to Minister Haggie for his comments before we go into our questions for the remainder of this.
Thank you very much, Premier. Again, another day with zero, and that's great news. And I think it's a testament to how diligent the Newfoundlanders and Labradorians have been in helping us help ourselves. And I think we're due a pat on the back. It's been a hard period, but it's not over yet. We have contained a cluster, and that's been done by good old-fashioned shoe leather public health, using skills that have been fortunately readily available. The staff, both in public health and in healthcare in general, be they janitors, catering staff, or frontline healthcare workers that we're more used to in terms of nurses and physicians, all of them have done their part and gone to work under very uncertain circumstances. And I think that's a good opportunity just to pause and reflect on their contribution to keeping us all well and healthy. You heard Dr. Fizgerald reference some firming up, some tightening of our travel orders. There is, as people would be aware, an outbreak in Curl Lake in Alberta in one of the oil sand patches. And because of that, we have taken extra steps to make sure that those people returning from there will be met, will have to have an isolation plan, will be contacted by public health, and will get tested and are required to self-isolate. One of the challenges we have had with people coming in from outside the province is even with information provided by some of the carriers, they really don't actually grasp the differences between the province they're leaving and the one they're coming to. And I would urge family members who have kin coming back from anywhere, in actual fact, to make contact and to tell them what the situation is back home as regards our requirements and their obligations to protect themselves and protect us all when they do come home. I think what you're seeing now is something that Dr. Fitzgerald referenced, that paradoxically, as things start to look better, you'll find some areas of our orders, Dr. Fitzgerald's orders, actually get tighter as we move to adapt to the future. One of those issues will also be around enforcement. We've had discussions on a regular basis around how best to encourage and educate. But at the end of the day, we do need enforcement. And my department will be meeting with officials again tomorrow to discuss what needs to be done. Those people who are traveling and coming into the province from outside will see changes at airports and marine Atlantic and ferry terminals, for example. As Dr. Fitzgerald said, in a sense, it's been far easier to introduce these lockdown measures under the state of emergency than it's going to be to plan to adapt over the next little while to what will be a new future. I'm reluctant to use the word normal because no one, I think, who has experience before the pandemic would regard where we're going to end up in the next little while as the normal they were used to. It will be a slow process. Each step will have to be evaluated to make sure that it doesn't produce a further rise in the number of cases. The virus is with us, it's in our communities, it's still there, and it can only reproduce if we move and allow it a host. So those kind of restrictions, those kind of requirements are likely to be amongst the last to go. But whatever we do now, whilst it's guided by health and public health, and will involve, obviously, the healthcare system, it's going to entail a whole of government approach because it's not just the healthcare system that is important here in that sense. So we need to look at maintaining a capacity in acute care. By diligence and hard work, we've managed to keep our bed occupancy down. So we have around 600, 650 beds available should a surge come. Is that the right number going forward? If it's not, what would be the right number, and how do we continue to work towards that? So that will be an ongoing question. In terms of how we do our PPE, we have seen an improvement in that over the last week, and fortunately, we will be in a position in the not too distant future to try and build a small stockpile to, again, allow us some capacity to deal with a potential surge. How much we will need and what that will be, we hope to have some answers for in the next coming days as we piggyback on work done by BC and the federal government, for example. But outside of healthcare, we need to look at what we do with departments such as TCII and their links with business, education and early childhood development in terms of childcare, particularly for workers who may not be now regarded as essential, but certainly we would look at trying to get them back into the workforce. One of the other facets around Curl Lake is that we have some testing capacity. We are as broad in our testing requirements as any province at the moment. But should we use some of that capacity, and the suggestion has been made that even though from a public health point of view, the science would suggest that there are limitations and flaws potentially in testing these people from Curl Lake, common sense and an abundance of precaution might make that something that's reasonable to do, given the fact we do have tests, as it were, to spare at the moment. So again, we're working hard to plan for our our new adaptation. But there's no room for complacency. We know clearly that movement and mingling are a source of flare-up, but also we know that travel is a big risk factor too. So those areas there will be among the last to go when we look at how we adapt going forward. And as Dr. Fitzgerald said, we will still see new cases emerge, and some of those, unfortunately, might be quite severe. We will have to look at some of our measures as we relax, and we may even have to go backwards if the numbers and the monitoring show that we are having new cases on a go-forward basis. The last to go, personally, I think, will be the actual order I sign around a state of emergency. It has proved itself, despite it being new and untried legislation, to, I think, be one of the best pieces of legislation of its kind anywhere in North America. It enabled us to act swiftly, it enabled us to quash this, and it enabled us to apply good old-fashioned shoe leather public health early on. So with that, I would just like to end with a reminder that we are not at the end of this journey. We're still fairly near the beginning. We have a bubble that we've made for our family and our loved ones. We should protect that bubble and stay in it, and we should not burst anyone else's. The virus only moves when you do. And with that, Premier, I would hand it back to you, acknowledging that the technology seems to have failed us once again.
Yeah, thank you, Minister. And first of all, I think the message that's been consistent coming from all of us that spoke today is it's a big thank you for people for following the guidelines, but it's yet as we proceed into the future with some degree of caution, making sure that your safety is kept front and center in our minds, and that as we continue, as we plan for the future, it will also require your adherence, to the new measures. If there's relaxation that will come in place, we must continue to work together. So with that said, I will open it up to some questions.
Thank you, Premier. And for the benefit of Minister Haggie, we can still hear you loud and clear despite not having that video connection. We have 6 reporters scheduled for today's call. In the essence of time for today, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
If I've done the math right with that revision that Dr. Fitzgerald talked about, we're now 5 days in a row without 0 cases. So without any sort of benchmark or time frame for lifting these restrictions, how worried are you that people will decide on their own that things look good and they want to try and get back to some sense of normal?
I hope that people will have listened closely today and understand that, this is something that we need to do very carefully, and we need to do slowly and deliberately and thoughtfully. So I think people have proven themselves up to now. I know that it's been very difficult for people to do what we've been asking them to do. I appreciate that. It's been difficult for all of us. But I am confident that people understand the importance of following guidelines that we have set out, and I have great faith that they will continue to do so.
There was concern that this virus was spreading in the community, and with earlier testing criteria, people who had the symptoms couldn't get tested. Now everyone with the symptoms is getting tested, but we're still finding no cases. What does that tell you?
It's been reassuring. It may be that people are having milder disease and so are not feeling like they need to present for care or testing and may not recognize that is the case. It could also mean that there isn't a lot of virus circulating right now in the community. However, I will say that with the caveat that we don't know that. There have been studies done that have shown that up to 30% of people who didn't know that they were they had the virus had it. So we do need to still be careful. Just because people are not presenting for testing does not mean that the virus is not circulating in the community. And, this is an evolving situation, and as time goes on and we get more information and we see we're able to do different types of testing to look to see if people were exposed and may not have had symptoms, we'll have a fuller picture of what's really happening or what has happened in the province. So at this point, I think, given that it's a new virus that we still are learning about, we need to assume that it is still here and act accordingly.
We heard concerns from Mr. Crosby about, he said that, for example, a whole plane load of people, there was no one there to meet them, there's nothing requiring people to stop and talk to public health officials when they do arrive. Dr. Haggie, you mentioned some changes that are coming with how flights may be met. Will they be addressing those issues?
The short answer, Peter, is yes. The reason that flight wasn't met was there was a failure by the airport authority to actually inform Eastern Health to send folk down. So that was a communications failure. From henceforth, the requirements now will be tightened up at the airport. You will see RNC cadets, uniformed wildlife enforcement will be there to try and spare some of the load on the RNC, for example, and similarly at the Marine Atlantic Terminal. If those measures do not work, we will institute more on the advice of Dr. Fizgerald.
So I think, Peter, it's important as we look at measures, and if we get to the point, or when we get to the point that we can make some changes, is there a couple of things I think that you'll see that's consistent no matter where you go, and that people talk about. One is around border control. Some discussion has been mentioned already around testing, but all of those issues has been discussed in our all-party committee that meets, every morning. And so the fact that this one flight was missed, as the minister has just said, was not as a result of the public health officials, that work at the St. John's Airport. It was indeed something that was from a scheduling issue at the airport itself. All of this information has been discussed many days ago within our committee, as well as the plans, as the minister has just said, that we began on the weekend. And this information was shared with our committee early on Monday, and again yesterday, and again this morning. We chat a lot about, what border control should look like, and what we're endeavoring to do is get to some kind of consistency around every single point of entry, within our province. So that's our goal. That's the objective. The officials, as been mentioned, from FLR, from Fishery and Land Resources, are leading this right now, and we've had a lot of success, this week already. And so it requires some training. In some cases, it requires some exemptions of sidearms and so on that could come into the airport. So what we're looking for is consistency. That will give us tight control over our borders, and that's instrumental as we continue to make changes with relaxation of measures into the future for our province.
Thank you.
Our next questions are from Andrew Robinson of The Telegram. Please go ahead.
Eric, at this point, looking at or having discussions about the possibility of what services may come back, has there been any look at how that may be treated within the healthcare sector? I know in particular elective surgeries are not happening. Would there be any expectation as to how soon elective surgeries might return if things continue to go along smoothly with people abiding by the different restrictions laid out?
That's another very good question. It's one that actually occupies ourselves and the regional health authorities on a regular basis. What we did by closing the hospitals to elective procedures was we created an ability to free beds in case of a large number of people requiring hospitalization. We have about 50% of our beds now free across the RHAs. The question is, when we go back to allowing surgeries, and I suspect these will not be elective in the sense of truly planned. These will be things that maybe weren't urgent in February, but now have some degree of time constraint. When we go back, how much of that empty space do you use, conscious that with very short period of notice, you could actually start filling up beds? Should we run at 80% capacity? Should we run at 70% capacity? And what can you do within that? So that's going to be a balancing act, and that's certainly something we're looking at. The other piece as well is in terms of diagnostic procedures like scans and x-rays. Whilst those don't impair the ability of beds, for example, they do actually expose healthcare workers to a large number of people moving through the building in a small period of time. So at the end of the day, what we will do is look at what's happened in other jurisdictions. We will try and use any modeling that might be able to inform us. But quite frankly, I think what we're going to have to end up doing is taking an educated guess, picking something, trying it, and seeing what happens. And this is where the flexibility and the maintenance of a state of emergency needs to come in, because we may get it wrong the first time, and we may get it wrong the second time, but we need the ability to adapt. So that's a constant question that we ask ourselves.
The mention was made of the clerical error resulting that was considered positive on April 18th, now not being positive due to the clerical error. I know it was mentioned specifically this was not a case of a false positive. What is the potential for a false positive testing result? I know it's been, I think, said before that the potential for negative results to, in fact, later turn up positive, there's potential there. What would you say to the potential for false positive testing?
The testing is actually very sensitive and specific for positive. So if you if the sample has COVID-19 in it, so if there is the virus in that sample, the test is almost 100% able to pick up those tests. So if the test comes back as a positive, it is almost certainly a positive. There is almost certainly COVID-19 in that specimen. So it's a little bit different with regard to the false negative, although this test itself is good at detecting negatives as well. With regard to a negative test, there's a little bit more that can be at play there. So, it has to do with when the virus is being shed by the patient, in what part of the disease progress that they are, the technique that's used to take the specimen. All of that can have an influence on the potential for the virus to be in the specimen itself. So, but if the virus is there, the test is exceptionally good at picking it up.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering about the barricades that are now popping up throughout Labrador. Premier Ball, if you can speak to this, seeing that these are being done more by the towns than by provincial government, but if you can still speak to it.
Yeah, so we had a long conference call on Saturday with all the leaders throughout Labrador. We had 4 MHAs on the call, as well as our MP. We had Indigenous leaders on the call, so it was a very detailed call and impacts on communities. Of course, in Lab West and in Central Labrador, we still have some people that with the mines actually in Lab West would be open. There's still some projects that would be ongoing in Happy Valley Goose Bay, as well as Happy Valley Goose Bay, of course, being the hub for transportation into the North Coast. So we've been working very closely with those leaders. We do plan another call with them again this weekend. So one of the questions that was raised to me last week about things like how do we was around essential workers and those that potentially could be traveling into the communities in a non-essential basis. So what they wanted to make sure is that anyone that was traveling in there, it was for essential services, and they were essential travelers. So they'll be putting up some checkpoints, putting those in place, and just, speaking with those travelers, just making sure that they are essential travelers.
Thank you. And I'm wondering, I know we had the restrictions put in place when it comes to long-term care homes and some of those private care homes in terms of staff working between them. What about for other specialties of work, say a cook that may work at a correctional center and also works at a local hospital?
Kellyanne, we've looked through the regional health authorities at people who work in other facilities and other areas. That's the easy bit to deal with. Certainly we do, i.e. Eastern Health does, and I think Western provides some healthcare services in the correction facilities out there. I know that they were aware of that as an issue, and particularly the risk of getting COVID into a correctional facility is significant. From my point of view, my understanding is that they have reduced this wherever possible, consistent with maintaining essential service.
Great, thank you. And I know we're not ready to lift restrictions yet. It is being looked at. There's a plan that's being built. What can you say to those people that have made plans for closer to December in terms of weddings, or they've had a loved one who's passed and they're looking to see when they can actually have a proper funeral?
I think that's going to be a question of a movable target. Certainly, if you book towards the end of the year, there is some cause for potential optimism. That might be the actual case. There is a degree, though, of uncertainty about the way this virus will behave in a global nature. You're seeing resurgence of cases in areas where they had thought they'd eradicated it, and I'm thinking particularly again now Singapore. But quite frankly, until there is a vaccine out there and until it is widely used, it is going to be one of those situations which will have a significant air of unpredictability about it. And really, it's impossible to gaze into a crystal ball and give you a clear picture.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Minister Haggie, you spoke about elective surgeries there a little bit, but I was wondering about those who are waiting to have surgeries like cataract surgeries that were pushed back due to COVID-19, and those people who are sitting at home and possibly losing their vision right now. What do you say to those people in terms of when they might be able to possibly get a surgery?
The decision about who would go when should, even under the current circumstances, is one we have left and will continue to leave to the clinician, the referring physician and the specialist who's doing the procedure. They are the only ones who are in a fully informed position and have the expertise to decide who needs to go when. There has been no restriction, for example, on cancer surgeries, other than those that have been imposed by surgeons themselves saying, well, this can wait for a period of time, and we will review that on a regular basis. So the facts of the case are is if you have a situation like that as a patient, then you should contact your referring physician, who will then present that new information to the specialist, and that decision about where you go on the list at what time will be made by them.
Okay, and just further to Kellyanne's question there in the long-term care homes, given the challenges pre-COVID with staffing in long-term care homes and now the absence of family volunteers, et cetera, is there any chance staff will be redeployed from other acute care sites that have low volume patients at the present time to maybe help provide care in long-term care homes, even some extra staff to help with feeding, hydration, or even like FaceTime calls to families?
We've certainly looked at the staffing levels as these decisions have been made, and I think one of the things that the health authorities were very keen to do was to make sure that the staffing levels, when they made these changes, would be adequate. There are actually surprisingly few individuals who work in long-term care, for example, and who have second jobs, as it were. I think the fraction is about 0.5%. So we have not been informed at the department level of any challenges around long-term care staffing.
And Premier, we know the RNC have some different phone lines and initiatives around domestic violence and violence against women during these hard times that often see spikes in abuse. But what firm action is the provincial government taking in addition to what's normally done to help these dealing with domestic violence?
Yeah, so one of the things that's extremely important as we work our way through this, this pandemic, is that we will continue to monitor, continue to monitor the capacity that we have within the system, not just in our healthcare system, but the space available in places like transition, houses, and what we would have available in terms of capacity that we could bring in if those situations became stressed. And we've been able to do that, and we're very comfortable right now in knowing that we, even within transition houses and within the capacity that we've already been able to identify, could be using places like hotels and so on. So we have space available. Added to that, it's important that we put the support lines in place so that when people find themselves in a situation, they can actually reach out in a safe format. One of the things that I know late Friday last week, I met with my Premier's Youth Council, and they had some real interesting ideas in terms of texting as opposed to call lines and so on. So we're taking advice from people that are involved in this, and we're working very closely with those associations. But right now, we have the capacity within the system, both within transition houses and excess capacity that we've identified in the community should people find themselves in those vulnerable situations. We know, and we work very closely with the Department of Status of Women as well, and they're working very closely with those community groups, making sure that we put those supports in place for those. If they need it, when they need it, it will be available to them.
Thank you.
Our next questions are from Elizabeth Whitten of All Newfoundland, Labrador. Please go ahead.
Thank you. I was wondering how many doctors have now signed up for telemedicine or virtual care, and is that still covered by MCP?
The last figure I have, which was the end of last week, was over 600. I can get you an up-to-date figure. We have instituted for the duration of the pandemic a blanket code for virtual care, which covers both the use of the telephone or any video software, assuming they have more luck with Skype than I did today. And that is covered by MCP. And in actual fact, the rates are quite generous.
Perfect. And I'm also curious, is there any plans to possibly introduce random COVID testing in the future, especially considering we have asymptomatic and pre-symptomatic cases?
So what you're talking about is Sentinel testing. And so we do have, it's not really random, but we do have some Sentinel testing now that we are doing. So people who are admitted to long-term care facilities and personal care homes will be tested upon admission. We are testing some asymptomatic contacts. We're also testing, for example, the people from Curl Lake will be testing asymptomatic people there. That is certainly something as we continue to move through this and we develop measures with regard to I guess a de-escalation in some regards. We will certainly be looking at Sentinel testing as one of the ways that we can maybe get ahead of finding cases in our community faster than we would if we're just waiting for people to come with symptoms.
I guess I was also curious, is there a concern that maybe some people are deciding not to call 811 or go for testing because they either don't want the stigma or maybe they don't want to be possibly accused of violating orders like over Easter weekend?
I hope that's not the case. I would encourage anyone who fears that they may have come into contact with someone with COVID or has symptoms that are consistent with COVID-19 to present for testing, to go to 811, to either call or to go onto the website and do the self-assessment. We certainly want anybody who has symptoms to come forward, and there's no judgment.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Premier, I wonder if you could react to the announcement from Husky that they're suspending work on the West White Rose project for the rest of the year. You've said previously, since the beginning of the pandemic, that your focus is on attracting new investment in oil and gas. But what does this new development portend for oil and gas activity in 2020?
Well, certainly this was one of the projects that we were counting on to provide significant employment and investment in Newfoundland and Labrador. is one that we'd all worked on, through the Department of Natural Resources and with the industry, big part of Advance 2030, which is our sector work plan. So for us, we've seen really what has been a crash in the oil prices around the world, and it's not just this project, but projects everywhere in all jurisdictions are really being very stressed right now. Demand is down, as we know worldwide. Supply is up. All our storage capacity around the world globally really is full as a result of the pandemic and as a result of some of the political things that have been happening over the past few weeks in jurisdictions beyond our control. So it's not good news for us, of course, because it creates employment, brings revenue to our province. But for us, the focus right now is working with the federal government to make sure that as a province we are competitive in the oil and gas industry. As we work through this health crisis, preparing for the economic crisis, and the oil and gas sector is an extremely important part of our economy, and it's something that we think that we are uniquely positioned where we are with the type of oil that we have that is not as carbon intense. So we have a good product here, we have a good commodity here, we have a great workforce here, and so right now we just make sure that we work with the federal government so that we remain competitive. So coming out of this, we will have an oil and gas industry in our province to support the revenue stream that we so badly need.
In Prince Edward Island, the chief medical officer said yesterday that the first phase of easing restrictions will really be about elective and non-urgent surgeries. I know we talked about that a lot today already. Would that be the same for Newfoundland as well in terms of the priority for easing restrictions?
Certainly from the point of view of the healthcare system, that would be a place to start. One of the questions, though, we have is once you open the door to elective surgeries, how far you can open it. Because the back end of this is we do need to keep a capacity in acute care that would allow for an ember or a cluster to appear that would require hospitalization. We don't know what that right number would be. The facts of the case are the healthcare service is only one part of the adaptations that need to take place. We need to look at new ways of doing business. We need to look at new ways of providing other services too. And I think that is a bigger piece. And the question there is around, again, what is the art of the doable, bearing in mind the risks of travel and interaction. So the healthcare system is simply one piece of this. But at the moment, those elective or planned procedures, be they cataracts or cancer surgeries or anything else that has a priority determined by the physician, the question is how and to what degree we do that.
So I think I think for all of us, that have been watching this and following, what's been happening in jurisdictions. First of all, I want to say for those people out there that are waiting for elective surgeries, and many of you have waited a long time. You were on a wait list before some of the measures that we had to put in place. So we recognize that how difficult this is. If it's hip replacement, if it's knee surgeries, you name it, all those elective surgeries that people have been waiting for. This has put undue stress in itself as we work and prepare the acute care system, our healthcare system, to deal with the pandemic. And there's no question we understand where you are, but as the minister said, there's a lot of considerations that we must keep in mind. And as Dr. Fizgerald so eloquently talked about so many times, this is really about planning, making sure that we continue to monitor the system that's in a position to respond to a pandemic, but yet find a way to provide some of those services. We're just not quite there yet. We'll require some extra planning, and we recognize the people and the suffering that people are going through as they wait to get those surgeries that were once elective that will, turn out to be something even more in the coming weeks and months. But, we're working on this, and there will be plans put in place for all those. But we can only do it when it's safe to do so.
I also have a question about the emergency alerts. There's some criticism in Nova Scotia about how those are rolled out. In this province, how do we determine when we're using these? And is there any, a request has to come from police to the province to be able to send out an alert. Any interest in streamlining that process to make it a little more, rapid in being able to send out these alerts?
We've used this system a couple times now during the pandemic, and this was really about, sending out, warnings to travelers coming into Newfoundland and Labrador, talking about things like self-isolation and so on. Just getting that information out there so that if you enter our province, you knew what the conditions you were entering our province under. So that happens through our Emergency Operations Center, through Municipal Affairs and Environment. So we reach out to that department, and we actually, in the cases that we've used it just recently, is we just, ask them, working with our public health officials and with Minister Haggie and his group, to make sure we get that information out there, those alerts. So that's in Newfoundland and Labrador. That is how we use that system in recent days during the pandemic and also around the Snowmageddon.
Just as an aside there as well, people who have filled in their cell phone numbers when they've arrived in the province from outside are actually getting texts now saying they're required to self-isolate, and just remind them a couple of days after they come back.
We have about 7 minutes left for questions, so I'm going to ask reporters, I'm going to call on you to press star 1, and we'll randomly take questions from the phone line. Operator, could you advise as to who is first?
Certainly. Peter Cohen from CBC News. Please go ahead.
We've seen elsewhere in the country, meatpacking plants have been a major source of outbreaks. With the prospect of fish processing plants opening, how would the situation be any different, and how concerning do those outbreaks there make the prospect of opening them here?
So we certainly have looked and learned from those situations, and we have made recommendations with regard to safe work environment to stop the spread of COVID-19. So certainly we have screening measures in place to ensure that people who are coming to work, or if we've recommended screening measures be put in place to make sure people coming to work are not unwell. We've also recommended methods for reducing the spread from person to person, recognizing that it is a balance between ensuring that our food supply chain is intact and the health and safety of those people working there.
Next question.
It's from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. We speak to elective surgeries and slowly lifting the restrictions that we're seeing in terms of healthcare right now. What is that backlog going to look like? Are we going to be able to afford all of the overtime and extra stresses put on staff?
Again, that's part of the plan. One of the interesting things is, under normal circumstances, around May, the regional health authorities start to look at running down OR capacities over the summer to allow people to have vacation time. So there is a lot of pre-planning that needs to go into this. The magnitude of the backlog needs to be looked at, but the rate at which that backlog is managed also needs to be looked at, because whilst you can do overtime, the rate limiting factor here is going to be the beds you put people in. Once they're full, you've no room for a COVID patient or any other patient if you run into difficulties. And we don't know yet what the right margin of bed occupancy is for the healthcare system at the moment. There is data or suggestions, rather, from other jurisdictions that we should leave at least 20% of our beds free at any given moment. So that reduces acute care capacity for planned surgeries. So there's a calculus going on there, and the surgeons and the RHAs are, at the moment, looking at their wait list to see what's built up over the last 6 weeks.
Thank you.
Next question, please.
It's from Ben Murphy, VOCM News. Please go ahead.
Thank you. Minister Haggie, are we still receiving shipments of PPE and masks from China at this time? And if so, has that been deemed safe to do so?
We are receiving shipments of PPE, again, smaller than we had anticipated and not always on time. N95 masks still continue to be the area of most concern, although the situation has eased over the last week or so. Whether they were all sourced from China or not, I would have to go back and ask. But certainly the ones we have received are up to standard, up to code, and fit for use.
Great, thanks.
We have time for one more question.
Please press star 1 if you have a question. Peter Cohen from CBC News, please go ahead.
Yesterday I asked about the R naught value, or essentially how many, for each person who gets the disease, how many are they passing it along to? Dr. Haggie, you talked about modeling numbers, but through contact tracing, does the province not have an actual number of how many people are being infected by each person who tests positive? Can we get that number?
This is a geeky question, and in actual fact, I shouldn't steal Dr. Fitzgerald's thunder because she knew this was coming and she has the answer ready at her fingertips.
Perfect.
So when we're talking about an R naught, we can really only talk about that at the end of the epidemic, and we can look back on it and know how many people on average did one infected person pass the disease on to. So what we're looking at really is what we call an RT, which is a reproductive rate at a point in time. And back at the beginning of the funeral home cluster, our RT was quite high. Right now, our RT is lower. At the moment, it is less than 1. It is around 0.4, 0.38 to 0.4. So, that's quite good. And when an R naught or RT is less than 1, and I may have misspoke yesterday and said less than 0. I'm not 100% sure, but it is less than 1. That means that if a person is infected, they pass it on to less than one other person. So that bodes very well for disease control. If the R naught is more than 1 or the RT is more than 1, then things can get out of control if we don't put measures in place to control it. So right now, modeling has put us in what looks like a promising situation. However, we have to be cautiously optimistic about that because we know that this virus can come in quite easily and can spread quite easily. So that's not a reason to relax all of our measures at this point, obviously.
Thank you very much for tuning in. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in Labrador. Have a great evening.